The White House admits it will not reach President Biden's coronavirus vaccination goal. You'll recall Mr. Biden was aiming to partially vaccinate at least 70% of adults by the 4th of July. People 30 and older have met that goal, but officials say they'll need, quote, a few extra weeks to get younger adults caught up. The pressure is building to get shots in arms as the Delta variant picks up speed in the U.S. 2 weeks ago, the dangerous strain accounted for 10% of new cases. That number is now at 20%. Experts warn the Delta variant could trigger another wave of infections. We'll have more on the growing threat in a moment, but we begin with CBS News Chief White House correspondent Nancy Cordes.
The White House had been hoping to make a big splash this 4th of July by meeting a big goal. Today, officials downplayed the near miss.
We don't see it exactly like something went wrong.
President Biden issued the challenge on May 4th. 70% of Americans with at least one shot within 2 months.
Let's try to hit that 70% mark.
But since then, the rate of Americans receiving their first doses has dropped from 882,000 a day to 320,000. Now the nation won't reach the president's goal until mid-July.
Did the White House believe that 70% was achievable when you said it?
There's no playbook for this. There's no record to look back and say these were the goals that were achieved 5 years ago or 10 years ago, because we're dealing with a historic pandemic.
White House aides argue young people are posing a bigger than expected problem. While 79% of Americans 50 and up have gotten at least one shot, the rate drops to 47% among those ages 18 to 24.
The reality is many younger Americans have felt like COVID-19 is not something that impacts them.
I just don't see the point because I had already got COVID.
I'm not anti-vaccine in any way. Just more like literally laziness.
Delaware is now raffling off full scholarships for vaccinated students.
Here's the joint.
Some places are even handing out joints for jabs, a free marijuana joint to adults 21 and up.
I'm Janet Shamlian in Houston. Tonight, the CDC is warning America.
As long as there are those who are not vaccinated, COVID-19 will remain a threat.
The Delta variant is fueling a COVID resurgence. Now more than 20% of all new cases, doubling in a week. First identified in India, research indicates the Delta variant is more contagious and potentially more deadly.
People who get this virus have higher viral loads, and they have those viral loads for longer periods of time, so they shed more virus.
Doctors say children under 12, not yet eligible to be vaccinated, are now among the nation's most vulnerable.
We're going to be delivering the information as quickly as possible so that the American public can be ready then to take these vaccines, accept them so that their children can go back to school in the next school year.
CDC studies show the Pfizer vaccine is 88% effective against Delta if fully vaccinated, but only 33.5% for those partially vaccinated. Missouri now leads the nation in per capita new infections. Patients are overwhelming this hospital in Springfield.
It's a lot younger population and a lot sicker population.
Dr. Robert Atmar of Houston's Baylor College of Medicine is looking to what's next.
We want to be prepared for the possibility that a booster dose may be needed.
For now, the priority is getting shots in arms.
This upswing is going to cause deaths. There's going to be people you know that are going to die because you were not vaccinated.
The CDC says that Colorado has the second most Delta variant cases in the nation and that they follow Missouri. Public health officials in Colorado estimate that 40% of the COVID cases there now are the Delta variant. Elaine?
Janet Shamlian, thank you. Dr. Taison Bell joins me now. He's a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Doctor, welcome. As we just saw, the White House says it will not meet President Biden's goal of having 70% of adults at least partially vaccinated by the 4th of July. But Dr. Anthony Fauci says this was never the end game. He says the ultimate goal is to, quote, crush the outbreak completely in the U.S. How can officials accomplish this? And given the lagging pace of vaccinations, how long could that take?
Well, I do agree with the White House that the absolute number of 70% didn't mean as much as getting as many vaccinated people vaccinated, or as many people vaccinated as possible. So the day before that July 4th goal and the day after that July 4th goal, we still want to make sure that we're vaccinating as many people as possible. I think what's of particular concern is that out of that 67% average that we're projected to hit, that's made up of some areas of the country, particularly in the South and parts of other areas of the country where the vaccination rates are particularly low. And these are the areas that are going to be very vulnerable to Delta variant or other variants or resurgence when we come into the summer months when people go indoors, or especially in the winter when coronavirus has its natural season.
Well, one expert said there are, quote, two Americas right now. Some states are thriving in their vaccination efforts. Others have fallen far behind. What do you believe is at the center of this divide?
Well, we've seen how, there's a lot of misinformation out there. And I think that's one area that we absolutely have to correct. And then access is still an issue for some areas. I think it's less of an issue than it was before, but it's still something that we have to work on. So as much as we can, getting into communities, making vaccine widely available where people interact in their daily lives, that's what we really need to do, and keep encouraging people to get vaccinated, keep getting accurate information out. We really fight this with a community-based approach.
Well, one expert tells CBS News the Delta variant will, quote, clearly trigger another wave, adding the virus, quote, will still find you if you are unvaccinated. Can another surge be avoided at this point? And how bad could a Delta-driven outbreak get?
I think we could ward off another surge. The data on fully vaccinated adults in children is very encouraging when it comes to Delta variant. But if you are not fully vaccinated, you are vulnerable to this variant. And so that means that these areas where there's low uptake and not adherence to public health measures, these areas, unfortunately, I do expect they'll have some issues when it comes to the summer and the fall.
Well, we're also starting to hear about the Lambda variant coming out of South Africa. What do we know about this strain?
Well, as far as we know, this is discovered over August or so in South America. And at this point, it's made up the majority of cases in the South America region. The WHO has classified this variant as a variant of interest. It carries a few mutations that could make it more transmissible or more evasive when it comes to vaccine. More studies need to be done to really fully understand this. But it's another one of these variants to watch, and it underscores the need to make sure that we vaccinate the global population as well. Because, of course, if we have more and more variants that come along, there might be that one that could find that ability to escape the vaccine protection that we have so far, be more transmissible, potentially be more deadly, and really put us back to square one. So initiatives like COVAX, we really need to step up efforts to make sure that we get more global vaccine distribution underway.
Yeah, I mean, could you elaborate a bit more? I mean, how might these new variants impact our recovery from this pandemic? Will they simply stall our efforts, or can they also set us back?
Well, they have the potential to require another booster dose of vaccine. And, I can anticipate we'll need it at some point. But if we have a new variant that evades the vaccine protection that we have so far, then that really means we have to start from square one when it comes to vaccinating and protecting people. We also need to take into account that some of these variants can be more transmissible. And so the normal public health measures that we're doing and thinking about going into the fall, opening up back schools, offices opening back up, this is a perfect sort of situation for a variant that has that extra ability to spread, to really take hold and cause another resurgence. And so these are all things that we have to keep track of and be mindful that if we can vaccinate and keep infections down, the chances of having these variants that can pop up later down the road become less and less and less.
All right, Dr. Taison Bell. Doctor, thank you very much.
Thank you.